Often, patients who present with lymphedema also have other serious medical conditions which complicate the standard of care. The purpose of this video is to discuss these conditions and to present a test case of a very medically complex patient and to explain the treatment protocols and modalities used for her successful outcome. It's suggested that a multidisciplinary team approach for these patients is not only desirable, but essential for optimal therapeutic outcomes. Treatment options are sometimes limited for a multitude of reasons, including transportation restriction, financial limits, and poor compliance with bandaging. Therefore, we are also interested in exploring the benefit of using foam-filled liners under compression pumps to manage lymphedema when these treatment options are limited or restricted. Susan is a very accomplished woman with an amazing history. She's a person with many accomplishments and talents. She's a determined individual with a very strong will. As a young person, she was an accomplished athlete in tennis, golf, and swimming. She was the Washington State High School tennis champion and was the #2 nationally ranked high school amateur for 5 years. She's a world-class singer and had won the regional television talent show Star Search as a young woman and was offered a contract with RCA Nashville. However, she decided to return to Tacoma for family commitments. As an adult, she held some very impressive positions in her varied career. She was a producer for ABC Sports, a cosmetic coordinator for 23 Bon Marché department stores in 5 states, and had been pursued by other large corporations to manage their cosmetic lines. In 1994, in her mid-40s, Susan developed back pain, which resulted in a thoracotomy at T7-8, a double discectomy at L4-5 and L5-S1, and had major surgery for a pelvic tumor. She was 5'10" initially and weighed between 170 to 180 pounds. She had a complete and uncomplicated recovery for each of these conditions until 2 years later. In 1996, she developed a severe shocking pain in the left 4th and 5th toes. She was seen by a doctor at a reputable medical center who initiated the use of a neuropathic drug to aid in pain reduction. By 1998, Susan was referred to another neurologist as her pain was increasing in severity, and she was also experiencing swelling in her legs. Further testing, which included a biopsy to the left lateral ankle, absolutely revealed neuropathy and a possible mitochondrial disease, a known genetic condition. No medical intervention was recommended, as no treatment was known for the condition at that time. Her weight ballooned to 302 pounds, and ongoing edema was present in her legs. She was referred to a genetics unit at another major medical center, where she and her daughter were both examined, and another biopsy was performed to further investigate any genetic link to the possible mitochondrial disease as the reason for her ongoing pain. The biopsy found no evidence of mitochondrial disease. Susan continued with unrelenting pain, and her daily neuropathic prescription was again increased. She developed high blood pressure, blurred vision, significant edema in her legs, weakness. She had tremors, balance problems, facial palsy, and suicidal thoughts. By 1999, after referral to a reputable pain center, she continued with the same neuropathic drug prescription. In addition to the existing symptoms, she was developing depression, difficulty sleeping, constipation, and chronic muscle and joint pain. She could only walk a maximum of 15 steps. She had difficulty swallowing, had a burning sensation while urinating, and was vomiting regularly. She had extreme difficulty walking or transferring from a wheelchair due to this weakness and very poor reflexes. By 2000, Susan could no longer stand or walk. By 2003, a permanent pain pump was inserted in her body. Severe edema, pain, and weakness were part of Susan's everyday existence. Her neuropathic prescription and pain drugs were increased again, and a diuretic was added, but little relief was realized. Worsening symptoms included vomiting, nausea, general malaise, and pain. She developed blisters on her legs, which were weeping lymph fluid. A recommendation from a specialist was to discontinue eating altogether and be fed by feeding tubes, but she didn't follow that advice. She took herself off the neuropathic drugs and reduced her use of pain medications on her own, but intractable pain persisted for another 13 years. After seeing a total of 86 doctors over 20 years, and after spending a total of $3 million on her medical care, she felt she was coming to her end. By 2013, Susan had developed multiple fractures in the bones of her feet and found that the stand pivot transfers from her wheelchair to her bed or vice versa were excruciating and causing even more swelling. Her physician suggested amputation as there was little hope that her feet and legs would ever heal. That year, a friend of hers found a brochure about a nonprofit organization which provides education about lymphedema with self-care classes for the treatment and management of the condition. She contacted the Northwest Lymphedema Center and met with the director, Lynn Foss, who was an RN and a certified lymphedema therapist.
I volunteer my time here at the Northwest Lymphedema Center. I'm a registered nurse, a lymphedema therapist, and I've been managing my own lymphedema of my legs for the last 40 years. After consulting with Susan and hearing her whole complicated history, I felt she could benefit from having JoviPak garments. So I called Joanne Rovig and Carol to come in and to help create a custom garment.
Joanne is also the owner of JoviPak, a corporation which manufactures garments for the lymphedema patient. Joanne listened to the story of Susan's journey with the pain and swollen legs and recognized the potential for helping relieve her of the ongoing condition. Joanne also consulted with me, as I am still an active lymphedema therapist and have a great passion for this lymphedema population. We initiated a collaborative effort to help this beautiful lady with a sad story recognize that treatment would improve her condition and begin a journey of recovery. After a full review of Susan's medical history, it was important for us to consider what contributing factors had led her to the current status so we could develop a treatment plan. We knew she had a lymphatic problem. After listening to her diet regimen, we suspected that her nutritional status was also compromised. Her pain doctor recognized that a contributing factor to her edema in the legs was the pain medication, but he was at a loss as to how to manage the swelling and manage the pain. If ever there was a need for a team approach, it was now, and a long-standing vision of Joanne Rovig was the establishment of a wellness center for patients like this. The Lymphedema Nutrition and Wellness Center in Kent, Washington was in its final stages of development. The mission statement is that it should be a team of healthcare professionals working together to identify the contributing factors essential to the successful treatment of lymphedema. 2 certified lymphedema therapists, one who is a nutritional therapy practitioner and one who is an OTR, an RN who is also a lymphedema therapist, and an ND, a naturopathic doctor, were all intimately involved in the care plan, and this is how we proceeded.
When I first met Susan was in this office, and they had brought me in as the team, and I looked at her and I was like, oh my goodness, we have a lot to work with, because Susan wasn't getting out of her wheelchair at that time. And I recognized right away, looking at her skin, that her system wasn't circulating well because the tissue was looking poorly, and that her immune system wasn't firing well because she was having some fungal issues with her toenails, which made it very obvious to me that she needed help. I also realized that in order to detox this lady, that we were going to have to introduce some different changes of water, food, and probably some herbs to help with the inflammation and bring back the immune system to homeostasis, where we would prefer it to be. So I knew my work was really cut out, but I also could see it in her eyes that she was going to be right there with us, working with us, and that she wanted to survive and to become healthy. So that was really important for me to see.
In deciding what the treatment plan should be, Joanne Rovick and I decided that a modified combined decongestive therapy program was essential. The regimen for the treatment of the lymphopod goes like this. We provided manual lymph drainage to the neck and shoulders prior to lymphopod use. Susan was also instructed in self-manual lymph drainage and deep diaphragmatic breathing. The lymphopod was set at 60 minutes in duration and at 45 millimeters of pressure in the sequential setting, not the pre-treatment setting. And the use of Jovipac transitions were done on the left leg only during pump session and nothing on the right. Following the pump session, she was bandaged with short stretch bandages over the transitions liner, the lower leg and the thigh, on the left leg, and Artiflex and short stretch bandages were used on the right leg. The treatment schedule was 4 to 5 times a week for 2 to 3 weeks. Volumetrics and pictures were to be taken on Fridays. We provided patient education and instruction in nutrition and self-care techniques were to be given during her treatment sessions in the treatment facility. She also was given a home program of exercises to enhance the effect of manual lymph drainage. Susan was then to return an understanding of the regimen of her home exercise program. The goals were to reduce the volume of her legs by 50% within 90 days. We were going to fit her in the appropriate compression garments and devices, and to improve her skin condition so that the blisters were resolved and the color of the lower leg was reduced to at least a light pink or less. There was to be a soft tissue with no pitting in 90 days.
Once we decided to use the lymphopod on Susan, I realized there was an opportunity to prove something that I had suspected all along. And that is, if we used a transition liner inside of the pump, we would get even better results. So Carol agreed that we would put the transition liner on the larger leg and not on the smaller leg. And what happened was just exactly what I wanted to happen, is after 4 days, we had a 5% differential between the two legs. And the reason that was so important is because we started with the 10% differential. That was the answer we were looking for. We now knew that a transition liner inside of a pump improved the efficacy of both products. Plus, the very best part was Susan was more comfortable. So considering the additional comfort you had by having the transitions, we thought, okay, we now know what we need to know, what we wanted to know. So we started putting the transitions on both legs. And from there, and that was why, when we sent her home with the pod, thanks to LymphaPress, we sent her home with 2 sets of liners so that when she was at home doing pump time, she could use the liners, and it would be easy for her and she'd be comfortable.
It's very easy.
Now, there came a time when, yes, as you noticed, we can bandage, short stretch, right over the top of these transitions. And that is also a real time saver. Plus, it made it easier for you.
Yes.
You didn't have to deal with the liner and the padding and all that. You just put your short stretch. And it was clear, and bless you, I know it's not easy. We tried to make it easier with these.
Mm-hmm.
But we also realized that you had gotten to a point where once you got out of these and the pump at night, you needed to be in our regular nighttime garments. And that's when we made the full-length Jovi Pack night garments and put the Jovi jackets over the top so that this all got easier. But Susan continued to do this regimen, the transitions and the pump, twice a day at home. And don't think I've ever had a patient that has tried any harder or been more determined or more thrilled with the changes that it's made than Susan. It's been an exciting experience for all of us.
We're using this lymphopod to help her with the circulation of her system, but we also have to address the internal part. We have to help her with her liver detoxing these chemicals that were used to facilitate healing that really caused a backlash of lymphedema in her system. So we are going to be using nutrition and specific types of foods that are anti-inflammatory to reduce the inflammation, which will also help the pain, and will also help her cells be able to detox better. And we're going to be using water. We're going to be getting 2 quarts of water in per day and some natural minerals so that the cells will bring in good clean water inside and flush the metabolites of waste out. And this will help her immune system work better so that she can respond naturally to the foods and the environment without overreacting. Right now she has a little bit of overreaction. She's got some puffy eyes going, and we're going to help her reduce that. And she's taken a food intolerance test, and it shows some inflammation with some foods, and we're going to reduce those foods in her diet for a while until her immune system builds back into a normal state and she can handle those foods, and we'll reintroduce them slowly on a rotation. So it takes a whole team to be able to take care of our beautiful lady here.
The first 4 days of treatment were challenging for this patient, Susan in particular. She found the regimen difficult and had days when she had to remove the bandages before she could return to the clinic the next day. While in the treatment facility, Susan received education again about the lymphatic system and had nutritional counseling. Without any doubt, she had confidence in our ability to help her. She was committed to make this system work, as she recognized the immediate improvement after just 1 day of treatment. JoviPack also made plans to have her receive modified Ina boots for the use during the day, as she still couldn't don her custom day garments. The patient was excited about her progress, and for the first time in many years, was hopeful about her future.
October of last year, when I had my ankle was so swollen and it was so painful, I finally went to my doctor, and he sent me to a surgeon, a foot surgeon. And they took x-rays of both feet, that I had 13 breaks. My feet were shattered. They'd collapsed. And the best thing for me would be to get both legs amputated. That was my option. And needless to say, I wasn't rushing to make the call for that appointment to go in to get that done. But after having some prayer time, with the good Lord, I said, I need guidance here. I need to find somebody. And I didn't want to, I would never give up, but I was at that point in my life where nothing had happened for 20 years, and I had begged and begged 86 plus doctors for help, and nobody knew where to send me. I got to this clinic, I met Joanne, I met Carol, and my life was changed completely in just a few days. I had hope. I'd wake up in the morning with a smile on my face and ready to get out of bed and go. And before, I just didn't even want to give up or get out of bed. So this whole thing is, first of all, it's easy. It's comfortable. And I feel like a brand new person. I'm the old Susan. Even my voice has changed. People will recognize it on the phone. Your voice sounds so good. You sound clear and happy, and I have a future to look forward to now, where just a few months ago I didn't. And they told my husband I had 6 months to live. So here I am, and my whole life is changing. So I'm a happy girl, needless to say. And I hope others will learn about this and learn what can happen to their life too. And if I can, I'm here to help and show them what's happened to me. So.
Susan became quite ill for approximately 10 days following that first week of our treatment plan, and she was unable to follow the treatment plan we had established. We were unable to definitively identify the reason for her illness, but we suspect it was a combination of drug withdrawal and the movement of toxins from the tissue through the lymphatic system. It was also apparent that transportation to the treatment facility was an issue and a barrier for ongoing treatment. We recognized the importance of teaching self-bandaging and self-care and focused on this aspect of the treatment protocol in an effort to maintain her progress. Therefore, changing our treatment plan, not an uncommon scenario in treating lymphedema patients, is it? LymphaPress and JoviPak made it possible for Susan to have a LymphaPod and JoviPak transition pump liners for both legs. A home visit was made to set up the pump for her home use and to reinforce her and her husband's understanding of the treatment regimen and her own self-bandaging. As her health allowed, she returned periodically to the treatment facility to monitor her progress. There were reductions, there were some setbacks along the way, but her health and the integrity of her tissue became more and more improved. Customized JoviPak Enaboots were issued, and she continued 1 to 2 times daily pump therapy in her LymphaPod with the JoviPak transition garments. Visible and palpable evidence of the improvements were observed by Susan, by her therapist, and by her doctors, as you can see in these photos. By the 2nd month into treatment, she was able to self-don her custom daytime knit compression stockings, and she could wear shoes for the first time in years. She now uses the Enaboots for her daytime regimen as she needs to. She has custom classic leg garments with zippers that she sleeps in at night. She has been consistent in using this system of self-care for a total of 3 months. The most remarkable improvements noted are that she is able to walk again. She offered no complaints of pain in her feet or legs, even though she has significant sensory deficits. Measurements at 3 months clearly indicate she is motivated and able to do whatever it takes to get herself back to a normal life. She shares this story with the hope of inspiring others to challenge what some consider impossible.